So what is long COVID? Since the start of the COVID-19 pandemic, research has been conducted to understand the effects and also patient needs. Currently, COVID effects are categorised into three areas. Firstly, acute COVID. This is where COVID symptoms last for up to 4 weeks. Secondly, ongoing symptomatic COVID-19. This is where signs and symptoms of COVID last between 4 and 12 weeks. And post-COVID syndrome. This is where signs and symptoms that develop during or after an infection consistent with COVID-19 continue for more than 12 weeks and are not explained by an alternative diagnosis. So most patients will make a full recovery after the acute phase or only have very mild ongoing symptoms. But long COVID refers to people, so adults, children and young people, who have new or ongoing symptoms of a duration of 4 weeks and more after the start of an acute COVID-19 infection. So what are the effects of long COVID? Long COVID can have a significant effect on people's quality of life. Treatment pathways and understanding about the condition is evolving, as is the evidence base. Symptoms after acute COVID-19 are highly variable and wide-ranging. The most commonly reported symptoms include, but are not limited to, the following. Respiratory symptoms. So these are things like breathlessness or an ongoing cough. Cardiovascular symptoms. So this is things like chest tightness, chest pain and palpitations. Generalised symptoms. So things such as fatigue, fever and pain. Neurological symptoms. So these are things that sometimes we call cognitive impairment, but other people might talk about things like loss of concentration, memory issues, headache, sleep disturbance, peripheral neuropathy symptoms, so things such as people saying that they've got pins and needles or numbness, dizziness and also delirium, which if experienced is more common in older populations. Gastrointestinal symptoms. So this is things such as abdominal pain, cramps, nausea, diarrhoea, and also reduced appetite. Musculoskeletal symptoms. So these are things like aches and pains in your muscles and joints. Psychological and psychiatric symptoms such as anxiety and depression. Ear, nose and throat symptoms. So things like tinnitus, earache, sore throat or dizziness. Dermatological symptoms such as skin rashes. So what is the treatment available for people with long COVID symptoms? People who present with long COVID symptoms will initially be provided with a GP assessment. The reason for this is that some long COVID symptoms may also be symptoms of other illnesses, and it's really important that those are excluded. Therefore, the assessment will clarify whether a person needs treatment for a specific related condition or for long COVID. Again, it is really important that GPs screen for certain conditions prior to commencement on a long COVID pathway. After this, for some people, online self-help packages may be recommended. For other people, they may need a referral into a specific service or a clinic or department, depending on their symptoms. These pathways and services may be provided by a range of different providers. So we may ask ourselves, will my services change in terms of long COVID treatment? The answer to that is yes. All clinical services at Ardash provide services for people who may have long COVID. Therefore, it's important that all patient-facing staff are aware of these symptoms and also where to signpost patients in terms of help. Now, information provision may be the only way in which the care you provide changes. However, some services will provide adjusted pathways and have already started to access training and change their service delivery in order to support people better. At the current time, these are the following RDASH services who are considering adjustments to patient pathways in terms of supporting people who present with long COVID. So these are specifically IAPT services, respiratory and cardiology nursing services in Doncaster, memory assessment services, and access and liaison services. Here is a little more information in terms of how these services are adjusting their pathways. If you work in these services, it's suggested that you consider the NICE guidelines for long COVID and consider how you may need to think about this diagnosis too in terms of the treatment that you provide. So IAPT. There can be a number of psychological aspects concerning the recovery from COVID. Therefore, IAPT services in RDASH have accessed specific webinar training and have made adjustments to their services, specifically focused upon supporting people with the following symptoms related to long COVID: anxiety, low mood, fear of further illness and hypervigilance to bodily symptoms, nightmares or flashbacks, poor sleep, impaired memory function, effects on attention, memory processing speed and executive function, and fear or stigma of contaminating others. So our physical health services, our respiratory and cardiac nursing services in Doncaster are working closely with acute services and have already made adjustments to existing services to support people with long COVID. For patients experiencing problems with swallowing, fatigue, nutrition and pain, they may also be referred to one of our allied health professionals in RDASH. This may be an OT, physio, dietitian, and it may be in RDASH, but it also may be with our colleagues in the physical health providers to help them with these symptoms. People with long COVID may also present to our memory assessment services. And it is suggested that if you work in these services, you consider as part of your assessments how you assess people and also consider the symptoms of long COVID within your assessment. A routine part of memory services is to screen for comorbid symptoms. In terms of access and liaison services, again, our access and liaison services, although not providing direct treatment for people with long COVID, they may gain referrals for people with long COVID who require an assessment and adjusted care pathway alongside of their other support. In this case, it is important that assessors keep records and detail this. And this is one way in which our services have been adjusted. The second way in which our access and liaison services need to consider adjustment pertains to the detection of potential long COVID. Because our RDASH services are diverse, we may have people referred who are unaware that they've had COVID or unaware that they have long-term symptoms of long COVID, and these have not been screened. Therefore, when our access and liaison services assess someone, if they are presenting with the symptoms described above, we need to think about how we may refer them to their GP and into the place-based pathways that are being developed for long COVID in order to assist these patients with their care journey. So we may then think about, what if the demand for our services in RDASH becomes too much in terms of long COVID? At the current time, the demand for long COVID services is not high. Many people will make a full recovery or only go on to have very mild symptoms. However, we are aware that this may change as people become more aware of what long COVID is and as the pandemic progresses. Our clinical leads and care group leads are working closely with our informatics services to put monitoring arrangements in place for both assessment services for long COVID and also adjusted treatment services. The capacity and demand for these services will be monitored with regular reviews. So what is happening in my area? What can I advise my patients? In each place we provide care, so in Rotherham, Doncaster and North Lincolnshire, there are long COVID clinics being established. After assessments by GPs, people will be provided with a referral to these clinics where they will be reviewed and linked in with a care pathway to suit their needs. Some of the clinics will be provided by RDASH services. Some may be provided virtually in other parts of the integrated care system. But be assured that all will follow the same model to support patient pathways. So what next? What can I do? If you want any further information in terms of long COVID, please read the NICE guidelines. If you want any more information about what's happening in your specific areas, or you want to look about how you can adjust your assessment or treatment pathways, please link in with your managers or clinical leaders who will have more information in terms of the services that are developing locally. Consider long COVID in your work with your patients and ensure that they know that they need to contact their GP if they feel that they have the symptoms. Provide your patients with information about long COVID and information that they may be seen digitally or also via the phone in order to support them. This will help them know what they can expect. Keep your eye out in terms of the daily communications. The integrated care systems in Humber Coast and Vale and South Yorkshire and Bassetlaw are developing information for patients and staff regarding long COVID. As soon as these are available, we will ensure that they are communicated to all so that you are supported and aware and can support your patients in the best way possible.